The agents which are useful for the treatment of tuberculosis are called as anti-tubercular agents. Anti means what? To oppose. Wherever this anti word comes, that time you should always think that it is useful for the treatment to oppose, to stop the certain things. So anti-tubercular, tubercular. So the chemical agents, the drugs, the medicines which are useful for the treatment of tuberculosis are called as anti-tubercular agents. So dear students, at the end of today's lecture, you will be able to define the anti-tubercular agents. You will be able to classify antimycobacterial agents. So anti-tubercular agent is also called as antimycobacterial agents. So if exam suppose question will come, define and classify antimycobacterial agent, that times you will say that, oh, sir has not taught us the antimycobacterial agent. Sir taught us antitubercular agents. So synonym for antitubercular agent is antimycobacterial agents or anti-TB drugs. After that, you will be able to draw and remember the chemical structure of isoniazid, para-amino salicylic acid, ethambutol, and pyrazinamide. So in this chapter, we are going to study the structure of 4 drugs, that is isoniazid, para-amino salicylic acid, ethambutol, and pyrazinamide. I am going to give a smart tricks to remember the structure of these 4 drugs. Very smart tricks and very useful tricks to remember these structures. You will never forget the structure of these drugs. Okay, so today we have 3 targets for our lecture. First target is already over, that is we have discussed the definition of antitubercular agents. Then we are going to discuss the classification of antimycobacterial or antitubercular agents. Then we will discuss how to remember and how to draw the structure of the antitubercular agents. So let's start with the tuberculosis. What do you mean by tuberculosis? Tuberculosis is nothing but the infectious disease caused by one of the acid-fast bacteria. It's named as Mycobacterium tuberculosis. So tuberculosis is an infectious disease which is caused by the infection of Mycobacterium tuberculosis. It is characterized by the formation of nodular bodies or tubercles within the lungs. It will form the nodular bodies. I will show you the figure how these microorganisms affect the lungs on next slides. Mostly, these infectious agents are able to infect any part of the body or any tissue of the body, but mostly it is infection at lungs. The most common site of infection of this Mycobacterium tuberculosis is lungs. So it is respiratory tract infections, you can say. मराठीमध्ये ट्युबरक्युलोसिसला क्षयरोग असं म्हणतात. सॉरी, क्षयरोग नाही म्हणत. I will give you the correct name of this tuberculosis next lecture, because leprosy also has some Marathi word for leprosy. Leprosy means कुष्ठरोग and tuberculosis means क्षयरोग. क्षयरोग म्हणजे tuberculosis. And leprosy means कुष्ठरोग. So tuberculosis means क्षयरोग and leprosy means कुष्ठरोग. So here you will be able to visualize what actually this Mycobacterium tuberculosis affects on lungs, and on these lungs there is somewhat tubular nodules will forms, and because of that, that particular persons who is infected with this Mycobacterium tuberculosis will have a persistent cough, or we can say a chronic cough with blood containing mucus. So not only the single cough, but that cough contains what? The mucus. Cough contain mucus. This is the one of the most important symptoms of this tuberculosis. So in this way, this Mycobacterium tuberculosis will able to infect the lungs. So there are two types of tuberculosis. First type is called as pulmonary tuberculosis. First type is called as pulmonary tuberculosis, in which there is infections on lungs. Infection on lungs. That's why that tuberculosis is called as pulmonary tuberculosis. That tuberculosis is called as pulmonary tuberculosis. म्हणजे काय समजून घेण्याचा अर्थ घ्या, जर ट्युबरक्युलोसिसनी जर लंगला इन्फेक्शन जर केलं असेल फक्त, तर त्या ट्युबरक्युलोसिसला पल्मोनरी ट्युबरक्युलोसिस असं म्हणतात. आणि मोस्टली अराउंड 80 to 90% इन्फेक्शन इज ॲट लंग्स. Around 80 to 90% infections is at lungs. So that's why all the tuberculosis which having the infections within the lungs are called as pulmonary tuberculosis. And another type is what? Extra pulmonary tuberculosis. Means what? The infections is other than lungs. Infections of Mycobacterium tuberculosis other than lungs, then it is called as extra pulmonary tuberculosis. So let's see the symptoms of pulmonary tuberculosis. Mostly the first symptoms is fever, followed by night sweats, fatigue, loss of appetite and weight loss. Most important symptom is the cough that lasts more than 3 weeks. 3 आठवड्यापेक्षा जास्त काळ जर आपल्याला खोकला जर येत असेल, तर याचा अर्थ आपल्याला क्षयरोग झाला असेल असण्याची शक्यता नाकारता येत नाही. आणि त्या कफ बरोबर जर ब्लड येत असेल म्युकस मेम्ब्रेन मधून, स्पुटमच्या फॉर्म मधून जर ब्लड येत असेल, तर आपल्याला ट्युबरक्युलोसिसची डायग्नोसिसची टेस्ट करणं गरजेचं आहे असं समजायचं. Along with this cough and blood present in the sputum, another one more important symptoms is shortness of breath or chest pain. ताप येणे, रात्री खूप जास्त प्रमाणात घाम येणे, थकवा जाणवणे, भूक मंदावणे, वजन कमी होणे, जास्तीत जास्त काळ खोकला येणे आणि श्वास घ्यायला त्रास होणे, हे सिम्पटम्स हे तुमचे ट्युबरक्युलोसिसचे आहे. But most important symptom is what? The cough with blood in a mucus. That is the most common symptoms observed in case of tuberculosis. If you see here, I have downloaded one image for you peoples. Okay. So tuberculosis effect on the lungs, and that time also it affects on some central nervous system, but it doesn't means it has infection on CNS. But through CNS there is appetite loss, म्हणजे भूक मंदावणे, फटीक म्हणजे थकवा जाणवणे, थोडा आपल्या CNS वर परिणाम होतो लंग्स वर इन्फेक्शन झालेलं असेल तर. लंग्स वर इन्फेक्शन झाल्यामुळे कुठले कुठले सिम्पटम्स आपल्याला दिसतात? चेस्ट पेन, कफिंग ऑफ विथ ब्लड, प्रोडक्टिव्ह अलॉंग विथ प्रोलॉंग कफ. Productive and prolonged cough. These are the symptoms associated with the lungs. And symptoms associated with the skin means what? Night sweats and pallor. Pallor, it means that the pale skin. पेलरचा शब्दशः अर्थ काय होतो? पेल स्किन्स. पेल स्किन म्हणजे काय? फिकट. आपली स्किन काय होते? फिकट होते, बरोबर. किंवा दुसऱ्या भाषेमध्ये तुम्ही असं म्हणू शकता, पॅलर मीन्स द लॉस ऑफ कलर फ्रॉम स्किन. आपली स्किन थोडी फेंट होत चालते, त्या कंडिशनला मग काय म्हणतात? पॅलर असं म्हणतात. ओके. So this is the symptoms of pulmonary tuberculosis. That is appetite loss, fatigue, fever, chest pain, coughing up with blood, prolonged cough means which is not end beyond the or up to 3 weeks, night sweats and pallor. स्किनचा कलर डल जर होत असेल तर त्याला पॅलर असं म्हणतात. Okay, let's see about the antitubercular agents. The agents which are useful for the treatment of tuberculosis, the agents which are useful for the management of the tuberculosis, the agents which are useful for the prophylaxis of the tuberculosis are called as antitubercular agents. Are called as antitubercular agents. Basically, it is classified into the two classes. First class is first line agent and second class is second line agent. Remember, every time if you are open any kind of book, either pharmacology or pharmaceutical chemistry, you will find out the classification of antitubercular agent is first line agent and second line agent. In some books, you will find out the first line agent is also called as primary agents or primary drugs. Sorry. And second line agent means the secondary drugs. Second line agent means the secondary drugs. So what is difference between these two drugs? We will see it. So first line agents are the agents which have high level of efficacy, means more potent. In another word, you can say that these first line agents are more potent with low toxicity. More potent and लो टॉक्झिसिटी, म्हणजे अशा ड्रगची पोटेन्सी चांगली आहे, इफिकसी चांगली आहे. ओके. आणि टॉक्झिसिटी ही कमी आहे, असे एजंट म्हणजे फर्स्ट लाइन एजंट. सो ड्रग्स with having the high level of efficacy against tuberculosis with acceptable level of toxicity are called as first line agent. And on the other hand, the second line agents are more toxic and less effective. First line agent is more effective and less toxic. But second line agent is what? More toxic than that of first line agent and less effective than that of first line agent. That's why it is called a second line agent. Because of its toxicity, these drugs are used very occasionally. Because of its toxicity, these drugs are used occasionally, but there is need to use of these drugs. लक्षात घ्या विद्यार्थी मित्रांनो, जरी सेकंड लाइन एजंटची टॉक्झिसिटी जास्त आहे तरी सुद्धा ते वापरले जातात. कारण जास्तीत जास्त वेळ जर आपण फर्स्ट लाइन एजंट जर वापरत गेलो तर बॅक्टेरियल रेजिस्टन्स प्रोड्यूस झालेला असतो त्या पर्टिक्युलर पेशंटमध्ये, आणि मग त्या केसमध्ये फर्स्ट लाइन एजंट इफेक्टिव्ह ठरत नाही. मग त्यावेळेस आपल्याला सेकंड लाइन एजंटची ट्रीटमेंट सुरू करणं गरजेचं असतं. लक्षात घ्या. म्हणून जरी सेकंड लाइन एजंट हे मोर टॉक्झिक असले तरी ते वापरले जातात, त्याला पर्याय नाही. लक्षात घ्या. ओके. सो फर्स्ट लाइन एजंट मीन्स व्हाट? More effective, less toxic, and second line agent means what? More toxic and less effective. So this is the classification of antitubercular agents. We will see the examples of each class. So first line agents, having the first drug is Isoniazid, which is discovered in 1952. Second drug is Ethambutol, which is discovered in 1961. Then rifampin, or it is also called as rifampicin. Some of the books you will find out the rifampin is named as rifampicin. Rifampinलाच rifampicin असं म्हणतात. Then pyrazinamide, which is discovered in 1952 along with the isoniazid. Streptomycin is antibiotics, which is also useful for the treatment of tuberculosis. So these 5 drugs are grouped in first line agents. These 5 drugs are grouped in first line agent. So isoniazid having which heterocyclic ring? Pyridine. आयसोनियाझाइडच्या स्ट्रक्चरमध्ये पिरिडीन हे हेट्रोसायक्लिक रिंग आहे. इथॅम्ब्युटॉलच्या स्ट्रक्चरमध्ये कुठलीच हेट्रोसायक्लिक रिंग नाही. पायराझिनामाइडच्या स्ट्रक्चरमध्ये कुठली हेट्रोसायक्लिक रिंग आहे? पायराझिन. So isoniazide containing pyridine heterocyclic ring, pyrazinamide containing pyrazine heterocyclic ring. Ethambutol does not contain any heterocyclic ring, but it contains the alcoholic functional group. If you see OL, ol is the suffix for this ethambutol. OL, that is for alcohol, that is hydroxyl group is present in ethambutol, and it having activity against this Mycobacterium tuberculosis. So if you want to remember the name of drug in first line agents, I am giving one short form, that is RIPE, RIPE. R stands for rifampin, I stands for isoniazide, P stands for pyrazinamide, and E stands for ethambutol. So these 4 drugs are mainly useful as a first line agent. No doubt streptomycin is also used, but these 4 are majorly used. So RIPE is the short form to remember the name of the first line agents. So R for rifampicin, I for isoniazide, P for pyrazinamide, and E for ethambutol. Okay. Then we will see the second line agents. Second line agent means what? The agents which are having more toxicity and less effectiveness against the tuberculosis. The first agent is PAS, 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 that is para amino salicylic acid. Para amino salicylic acid. Standard abbreviation useful for this drug is PAS, PAS, PAS. Then another example of antibiotic is kanamycin, amikacins. These are the antibiotics useful as antitubercular agents. Cycloserine and fluoroquinolones, for example, ciprofloxacin, norfloxacin, levofloxacin. These drugs are also useful as a treatment of tuberculosis. So this is second line agent, that is PAS, kanamycin, cycloserine, amikacin, fluoroquinolones, for example, ciprofloxacins, norfloxacins, levofloxacins. These are the examples of second line agent. So we have seen first line agent and second line agent drugs. Now we will start the individual drug, study of individual drugs. So we have completed our 2 goals, that is goal number 1, definition of antitubercular agents, and goal number 2 is classification of antitubercular agents. So dear students, here one question for you. You have to reply in your chat box what you have studied till definition and classification. On the basis of that, question is on in front of you. Name the heterocyclic ring present in structure of following drug: isoniazide and pyrazinamide. So name the heterocyclic ring present in isoniazide and pyrazinamide. पाहू बरं तुम्हाला समजलं का शिकवलेलं? तुम्ही हात की नाही लेक्चर मध्ये, का फक्त चालू करून दुसरीकडे कुठे फिरायला गेलात? प्रशांत पाटील, व्हेरी गुड. शुभम, काही पण उत्तर फेकू नको. ए आणि बी नाहीये, तुला 2 रिंग लिहायचे आहेत. निर्मला, करेक्ट. गौरव पाटील आणि शीतर स्नेहल वळवी, ए आणि बी आन्सरच नाही बेटा. I want the name of heterocyclic ring present in structure of isoniazide and pyrazinamide. Mangesh Katkar, your answer is wrong. Very good, Rajeshri. Very nice, Simran, Jagruti, Pooja. Okay, for isoniazide, ring is pyridine, and for pyrazinamide, ring is pyrazine. So pyridine and pyrazine is the answer of this question. So isoniazide is a standard abbreviated by using word INH. INH means what? Isonicotinic acid. So I for iso, N for nicotinic, and H for hydrazide. So INH is represented by isonicotinic acid hydrazide. These drugs are useful for the treatment of tuberculosis, and always all the tuberculotic agents or antitubercular agents are used in a combination. So this isoniazide is used in a combination of rifampicin, pyrazinamide, and either with streptomycins or ethambutol. So here there is one question for you peoples. You have to find out the reason, because this reason is asked in your pharmacology. Why the anti-tubercular drugs are given in combination? Why the anti-tubercular drugs are given in combination? Anti-tubercularच्या ट्रीटमेंटमध्ये अँटीट्युबरक्युलर एजंट कॉम्बिनेशन मध्ये का देतात? आणि डॉट्स तुम्ही ऐकला असेल, DOTS, डॉट्स आपल्या गव्हर्नमेंट ऑफ इंडियाची स्कीम आहे की ज्याला क्षयरोग झालेला असेल त्याला डॉट्सची ट्रीटमेंट दिली जाते. तर डॉट्सची ट्रीटमेंट म्हणजे नेमकं काय, ती किती दिवस दिली जाते हे थोडं तुम्ही नेटवर सर्च करा आणि लिहून ठेवा. याचा फायदा तुम्हाला फार्मोकोलॉजी ह्या विषयामध्ये होईल. Okay, so it will be very useful informations if you got it from any book. If you don't have a book, just Google it and try to find out the answer. Why these drugs are given in combinations, and why what is actual meaning of dots, and what is dose regimens and duration of treatment for the treatment of tuberculosis. So this isoniazide is combined with rifampicin, pyrazinamides, either with streptomycins or ethambutol. If ethambutol is used, streptomycin is not used. If streptomycin is used, then ethambutol is not used. But these two drugs are never taken in combinations. That is ethambutol and streptomycin. So what is the mechanism of action of this isoniazide? Isoniazide inhibits the biosynthesis of mycolic acid. It will inhibit the biosynthesis of mycolic acid, which is the essential cell wall constituent of mycobacteria. मायकोबॅक्टेरियाचा सेल वॉल ज्यावेळेस तयार होतो, त्या सेल वॉल तयार करण्याची मुख्य जो घटक आहे तो आहे मायकोलिक ऍसिड. म्हणजे मायकोलिक ऍसिड हा मायकोबॅक्टेरियमचा सेल वॉलचा मुख्य घटक आहे. ओके, मायकोबॅक्टेरियल सेल वॉलचा मुख्य घटक कुठला आहे? मायकोलिक ऍसिड. So biosynthesis of the mycolic acid is stopped by the isoniazide, and because of that there is inhibition of formation of mycobacterial cell wall. म्हणजे नवीन सेल वॉल तयार करण्याचं जे काम आहे ते स्टॉप केलं जातं, आणि ते स्टॉप कोण करतं? आयसोनियाझाइड स्टॉप करतं बाय इनहिबिशन ऑफ mycolic acid, by inhibition of biosynthesis of mycolic acid. So isoniazid is act on Mycobacterium tuberculosis by inhibition of mycolic acid biosynthesis. So if there is no mycolic acid, there is no formation of mycobacterial cell wall. जो महत्वाचा घटकच जर नसेल तर तो तयार होणार नाही. लक्षात घ्या. आपल्याला घर बांधायचं आणि घर बांधायला जर आपल्याकडे सिमेंटच नसेल तर आपण घर बांधू शकत नाही. लक्षात घ्या. सिमेंट नसेल, परीक्षेला आलात आणि पेनच नाही, तुम्ही पेपर लिहू शकाल का? पेपर नाही लिहू शकणार, कारण पेन नाही. बरोबर. तुम्ही दुसऱ्याचा पेन घेऊन पेपर लिहू शकाल, पण पेन लागेलच की नाही. सो पेन इज अ इसेन्शियल कंपोनंट्स टू राईट द एक्झाम. ओके. But in similar way, to form the mycobacterial cell wall, mycolic acid is a very important component. If there is inhibition of their synthesis, means there is no formation of cell wall. If there is no cell wall, so cell get automatically death. So by this way, this isoniazid drug is useful for killing of the Mycobacterium tuberculosis, that is infectious agents of tuberculosis. So isoniazid containing which heterocyclic ring? Pyridine. So isoniazid is pyridine containing anti-TB drug. So this is the structure of pyridine heterocyclic ring, that is 6-member heterocyclic ring containing nitrogen atom. Okay, so you can number from either directions 1, 2, 3, 4, 5, 6. So this is the structure of pyridine. Pyridine means what? 6-member fully unsaturated ring containing nitrogen as a heteroatom. Containing nitrogen as a heteroatom. So now next step is what? Observation of structure of drug and structure of heterocyclic ring. So this is the heterocyclic ring and this is the structure of drug. So if you observe these two structures, then you will find out that what? There is substitution at which position? Yes. If you observe the structure of both of these drugs, these structures, then you will find out what? Difference between these two structures. Yes, correct. So substitutions at 4 number position. Substitution is what? CONH2. CONH2. So IUPAC name of this compound is pyridine 4-carbohydrazide. Pyridine 4-carbohydrazide. Pyridine 4-carbohydrazide is the IUPAC name of this INH. INH is what? Isonicotinic acid hydrazide. Isonicotinic acid hydrazide. Why it is called as isonicotinic acid? If you remember the structure of nicotinic acid which you have studied in first year, or if you not studied, then I will show you the structure of nicotinic acid. So this is nicotinic acid. Okay, we have shifted the position 3 to 4 here. That's why it is called as isonicotinic acid. So it is isomer of nicotinic acid. That's why it is called as isonicotinic acid hydrazide. हे जर लक्षात नाही राहिलं तर सोडून द्या, याला आयसो काय म्हणतात वगैरे. Okay, so if you know the structure of pyridine, you can able to draw the structure of this acid hydrazide. Acid C double bond O, hydrazide NH2. Okay, so isonicotinic acid, if you remember INH, isonicotinic acid hydrazide, that is isoniazid containing pyridine ring having substitution at 4th number position. Substitution is what? Acid, that is C double bond O and hydrazide. आता ऍसिड म्हणजे C डबल बॉन्ड OH असतो हे मला माहिती, परंतु तो OH रिप्लेस कशाने केला? हायड्राझाइडने केला, म्हणजे NH2 ने तो रिप्लेस केला. Another way to remember the structure of isoniazide, that you have to remember these 4 lines. Okay, I am giving the 4 lines just within a few seconds. Okay, so that 4 line will help you to remember the structure of isoniazide. So first line is what? It is a pyridine containing drug. So you must know the structure of pyridine. So this ring is what? Pyridine. This ring is what? Pyridine ring. Okay. Second sentence is what? Isoniazide is called as INH. INH means what? Isonicotinic acid hydrazide. Isonicotinic acid hydrazide. So what is mean by hydrazide? Hydrazide is nothing but the any group which containing NH2. Hydrazide म्हणजे काय? That is group containing NH2. R stands for any other groups. And what is mean by acid hydrazide? That is CONH2. CONH2. So it is acid hydrazide. So C double bond O NH2 you have to just attach on 4th number position. So it is very easy to remember the structure of isoniazide. If you know these 4 sentences, then you can able to remember the structure of this. So first sentence is what? Pyridine containing drug. So you have to first draw the pyridine. Isoniazide is also called as INH, that is isonicotinic acid hydrazide. So last word is what? Hydrazide. So hydrazide means what? NH2. Latter word is what? Acid. So acid hydrazide means what? It is CONH2. So you can replace this R with pyridine ring. Okay. So IUPAC name of this is pyridine 4 carbohydrazide. IUPAC name of this drug is what? Pyridine 4 carbohydrazide. Carbohydrazide is nothing but acid hydrazide. Okay. So this is very simple trick to remember the structure of isoniazide. लक्षात घ्या, ह्या ट्रिक्स जर तुम्ही लक्षात ठेवल्या तर स्ट्रक्चर लक्षात ठेवायला तुम्हाला मदत होईल. जर तुम्ही ट्रिक्सचा अभ्यास व्यवस्थित केला नाही, ट्रिक्स व्यवस्थित फॉलो केल्या नाही, तर स्ट्रक्चर लक्षात राहणार नाही आणि मग आपण क्लेरिकल वर्क करतो, हो की नाही? क्लेरिकल वर्क म्हणजे काय? पाठांतर करण्याचा प्रयत्न करतो आणि परीक्षेला आपण विसरून जातो. म्हणून तसं करायचं नाही. थोडा स्मार्ट स्टडी करायचा आहे, कारण तुम्ही स्मार्ट स्टुडंट्स आहात. स्मार्ट स्टुडंट्स म्हणजे काय? द स्टुडंट्स आर एबल टू हँडल द स्मार्टफोन्स व्हेरी स्मार्टली, है की नाही? तुम्ही स्मार्टफोन्स व्हेरी स्मार्टली यूज करताय म्हणजे तुम्ही स्मार्ट आहात. जर तुम्ही स्मार्ट आहात तर तुम्ही या ज्या ट्रिक्स आहेत त्या स्मार्टली यूज केल्या पाहिजेत. ओके, आय विल रिपीट. Isoniazide is pyridine containing drug, so you must able to draw the pyridine ring. It is also called as INH. INH means what? Isonicotinic acid hydrazide. Then what is meant by hydrazide? Hydrazide is nothing but NH2 or NH2. Acid hydrazide means what? CONH2. So you have to just add this CONH2 at number 4. At number 4. So structure will become isoniazide. Structure will become isoniazide. Okay. So brand name of INH. So here I have make a list of the brand names which I have taken it from the internet source. Hydra is one of the brand name. Then Isovit, Leaniazide, Nidrazid, Rimifone, and Stanozide. So these are the popular brand name of isoniazide, that is INH. Now next drug is Ethambutol, which is bacteriostatic agents. So just give the answer what is meant by bacteriostatic in chat box. Ethambutol is a bacteriostatic agent. What is meant by bacteriostatic? So these drugs, Ethambutol, which effectively inhibit the Mycobacterium tuberculosis, which are resistant to INH or streptomycin, which are used for the treatment of tuberculosis, which are resistant to INH or streptomycin. Yes, Monica, very good. Rushali, very good. Then Pinbit, Nishan Patil, Gaurav Patil, very good. Inhibition of bacterial growth of bacteria, but they do not kill. Very nice. Very nice. So bacteriostatic agent. Bacteriostatic agent means what? The agents which are able to inhibit the growth, but they do not kill the bacteria. Inhibition of growth of bacteria called as bacteriostatics. And when this ethambutol is used, it is effectively inhibit the strains. Strains means what? The type of the Mycobacterium tuberculosis which are resistant to INH, that is isoniazide or streptomycin, that time this ethambutol is used. Okay, mechanism of action, MAO, mechanism of action. It inhibit the enzyme arabinosyl transferase. लक्षात घ्या विद्यार्थी मित्रांनो, जर मेकॅनिझम ऑफ ऍक्शन तुमच्या लक्षात राहत नसेल तर ठीक आहे, काय हरकत नाही, परंतु लक्षात ठेवण्याचा प्रयत्न करा, तुम्हाला फार्मकोलॉजीला उपयोग होईल. तुमच्यापैकी जे विद्यार्थी पुढच्या वर्षी डिग्रीला जाणार आहात, डायरेक्ट सेकंड इयरला ऍडमिशन घेणार आहात, त्यांना थर्ड इयर फायनल इयरला मेडिसिनल केमिस्ट्री हा विषय असतो, फार्मकोलॉजी हा विषय असतो, त्यावेळेस हे मेकॅनिझम ऑफ ऍक्शन खूप गरजेचे आहे, युजफुल आहे. जर डिग्री करायची असेल तर थोडा अभ्यास आतापासून सिरियसली करायला घ्या तुम्ही, की जेणेकरून काम होईल. ओके, कामात येईल तुम्हाला. Ethambutol inhibit the arabinosyl transferase enzyme, and that enzyme is essential for synthesis of arabinogalactam, which is again cell wall constituents. INH मध्ये आपण बघितलं की INH काय करतो की मायकोलिक ऍसिडचं बायोसिंथेसिस स्टॉप करतो. तसंच इथॅम्ब्युटॉल काय करतो, अॅराबिना गॅलॅक्टमचं सिंथेसिस स्टॉप करतो, विच इज इम्पॉर्टंट अगेन सेल वॉल कन्स्टिट्युएंट, विच इज अ इम्पॉर्टंट सेल वॉल कन्स्टिट्युएंट. म्हणजे मायक्रोबॅक्टेरियल सेल वॉल तयार होऊ द्यायचाच नाही. सेल वॉल जर तयार झालं नाही म्हणजे आउटर कव्हरिंग तयार झालं नाही म्हणजे इसेन्शियल सेल वॉल कन्स्टिट्युएंट लॉस होतील. इसेन्शियल सेल वॉल कन्स्टिट्युएंट लॉस झाले की ती जी बॅक्टेरिया असते, ती जी सेल असते, त्याचं लायसिस होतं, म्हणजे तो किल होतो, किंवा त्याचं जे इसेन्शियल कंपोनंट जर नसेल तर त्याची ग्रोथ काय होते, स्टॉप होते. म्हणून हे ड्रग वापरले जातात. So ethambutol is useful because it has ability to inhibit the enzyme that is arabinosyl transferase. That enzyme is required for the biosynthesis of arabinogalactam, which is the mycobacterial cell wall constituent. So by this way, this ethambutol is useful. So properties of ethambutol. No doubt, it is a white crystalline powder. It is very soluble in water. It is more effective in combination with isoniazid and rifampicin or rifampin. Remember, all these anti-TB drugs are taken orally in the tablet form. So it is orally active, administered in the form of tablet. And official compound of this ethambutol given in Indian pharmacopoeia and British pharmacopoeia is ethambutol hydrochloride. Another drug is ethambutol hydrochloride tablet. Ethambutol hydrochloride and ethambutol hydrochloride tablets are given in IP and BP. IP means Indian Pharmacopoeia and BP means British Pharmacopoeia. So this is the official drug. Now let's see the smart way to remember the structure of ethambutol. Dear students, if you observe the structure of ethambutol, it looks somewhat lengthy, somewhat long structure. ओके नाही, स्ट्रक्चर पाहिल्यावर आपल्याला असे वाटेल की किती लांब स्ट्रक्चर आहे, किती ऍटम झाले, सपोज 1 2 3 4 5 6 7 8 9 10 ऍटम झालेत इन चेन, इन स्ट्रेट चेन 10 ऍटम्स. स्ट्रक्चर पाहिल्यावर वाटतं आपल्याला किती मोठं स्ट्रक्चर आहे. परंतु आता मी तुम्हाला एक स्मार्ट ट्रिक देणार आहे, एक इफेक्टिव्ह वे देणार आहे की जेणेकरून तुम्ही इथॅम्ब्युटॉलचं स्ट्रक्चर इझिली लक्षात ठेवू शकता. I will give you a very smart trick depending on which you will be able to draw ethambutol within a seconds. Okay, I have studied these tricks since I was in third year B Pharm when I have studied, and that time also I have used the same tricks, and till date I have remembered the structure of ethambutol. I can close my eyes and I can able to draw the structure of ethambutols without any mistakes. Because of what? Because I am using this smart trick. आता लक्षात घ्या, आपण याच्या आधी स्मार्ट ट्रिक कुठली वापरली होती की क्लासिफिकेशन मध्ये आपण हेट्रोसायक्लिक रिंगचं स्ट्रक्चर नाव लिहायचं आणि त्या स्ट्रक्चर काढायचं, मग ड्रगचं स्ट्रक्चर काढायचं, दोन्हीच्या स्ट्रक्चर मध्ये काय फरक आहे हा बघायचा आणि तो फरक लक्षात ठेवायचा. याच्यावरून आपण स्ट्रक्चर लक्षात ठेवायचं शिकलो. आता आपण दुसरी एक ट्रिक शिकूयात की स्ट्रक्चर लक्षात कसं ठेवायचं, ती म्हणजे नावावरून. इथॅम्ब्युटॉल. Ethambutol starts with eth. Okay, see here, eth. Eth means what? Ethyl. Ethyl means what? 2 carbon atom. So actually ethyl we can written like that, CH3 CH2. So this is the actual ethyl. But in your structure, the middle portion, exactly center portion is what? CH2 CH2, two carbon atoms. So represent it as ethyl. So first you have to draw the center portion from your first name, eth. Okay, stands for ethyl. Then eth is followed by what? M. AM. It is followed by what? AM. And AM means what? Amino group. AM means what? Amino group. I know amino group is written like that, NH2. Bond with NH2. But if you in structure, first you have to draw the structure and then try to apply this logic. And after that you will able to draw the structure again without watching or without viewing the previous structure. So eth means ethyl, M means amine, so write down NH. Okay. Now next word is what? Butol. Next word is what? Butol. OL means alcohol. But means 4 carbon atom. Butane, isn't it? So but means 4 carbon atom. If you count this carbon atom, so there are 4 carbon atoms. So 1, 2, 3, and 4 carbon atoms. So but, ol means hydroxyl groups, that is butanol. That is butanol. So butol stands for butanol, M stands for amino, and eth stands for ethyl. Okay, eth stands for ethyl. So if you remember, I have divided this ethambutol word into eth plus M plus butol. So eth at center position. Okay, Am stands for amino, so NH group attached to ethyl, and butanol attached to amino group. So you have to attach butanol in such a way that second number carbon atom attached to amino group. हे तुम्हाला लक्षात ठेवावं लागेल. सेकंड नंबर कार्बन ॲटम अमायनो ग्रुपला अटॅच झाला पाहिजे. पुढे हे तुमचे 2 कार्बन ॲटम असे आणि वरती CH2OH. So whatever you have drawn on the one side of CH2 CH2 or ethyl, you have to draw same on right side, sorry, left side. So both sides should be equal. So center portion is what? Ethyl, and ethyl having two sides identical. Ethyl having two sides symmetrical. दोन्ही बाजू त्याच्या सारख्या आहे. मग एका बाजूला काय आहे? AM म्हणजे अमायनो, ब्युटॉल म्हणजे ब्युटेनॉल, आणि दुसऱ्या बाजूला पण अमायनो आणि ब्युटेनॉल. So this is the very easy to remember the structure of ethambutol. Only thing is that you have to remember how to draw this structure. Okay, eth stands for ethyl, so you have to first draw the ethyl at center position. M stands for amino. M stands for amino is what? Amino group. So you have to attach amino groups to this ethyl group. And butol means butanol. Butol means butanol. So you have to attach butanol at 2 number positions. So whatever you have drawn on one side of ethyl, you have to draw same thing on other sides. So it will becomes ethambutol. So this is how you can able to remember the structure. Practice it today. Today itself you have to practice it. By evening you will be able to draw the structure of isoniazid. You will be able to draw the structure of ethambutol, and you will be able to draw the structure of pyrazinamide also. And you will be able to draw the structure of PAS also. So between you are having only 52 structures in your syllabus. Out of 52, 4 structure is completed today itself. How many structures? 4 structures. It's completed today itself. Means you have now started the study of pharmaceutical chemistry 2. You have started to reaching the goal of your pharmaceutical chemistry 2. So this is my simplest way to remember the structure of ethambutol. Is it the simplest? Yes, reply. अशा पद्धतीने लक्षात राहील तुम्हाला स्ट्रक्चर इथॅम्बुटॉलचं की नाही राहणार? रिप्लाय करा, येस ऑर नो. Is it an interesting way to remember the structure? Yes. Very good, very good. So those who are replying, they are in class, and those who are not replying, they are just sleeping. Yes, very good. Thank you very much for your reply. Salar Sheikh is also coming to the lecture. Huh? First time. Okay, very good. So we are having 1 minute stops for your reply. Salar Sheikh, it means that you are having giving the reply first time today's. Okay, because I am observing the chat box continuously. Hmm? Okay, very good. So ethambutol is eth plus m plus butol. So you can able to remember the structure of ethambutol. So next is pyrazinamide. Next is pyrazinamide, which is occurs as a white crystalline powder, which is occurs as white crystalline powder. Taste is slightly bitter, so it has some bitter taste, which is sparingly soluble in water. As I told earlier that anti-TB drugs are available in the tablet forms, and always it is used in a combination with rifampicin, isoniazid, and either with streptomycins or ethambutol. So here I will give you one combinations. I have searched it for you peoples. Yesterday I have searched it. Okay. And then I am able to get the one combinations. Okay. If you able to see here, AKT4, AKT4 having the two tablets, A tablet, B tablet, and C capsule. Okay. So this strip containing what? A tablet, B tablet, and C capsule. A containing what? If you able to visualize it very clearly, you can visualize here. If you can't able to visualize it, then you can just Google it, AKT4, you will get this image. What it contains? Ethambutol hydrochloride and isoniazid in A tablet. So A tablet having combination what? Ethambutol hydrochloride and isoniazid. B tablet for pyrazinamide. So B containing two tablets. Okay. So pyrazinamide, and C part containing one capsule, and that capsule contain what? Rifampicin. So ethambutol, isoniazid, pyrazinamide, and rifampicins are used in a combination for the treatment of tuberculosis. So this pyrazinamide is combined with rifampicin, okay, as a capsule form, isoniazid and ethambutol in a tablet form, and pyrazinamide is another tablets. So that's why it is AKT4. 4 means 4 drugs. So first drug is pyrazinamide, rifampicin, isoniazid, and ethambutol. Sometimes it is also combined with streptomycin. So that time ethambutol is not used. Okay. So here one more questions to you peoples, because I want you should be attentive in lecture. So I have incorporated 3 to 4 questions at every 5 to 10 minutes. You have to solve the questions. So in front of you there is one heterocyclic ring. Okay, try to give the name of this ring. So name this heterocyclic ring. Yes, I want answer from you peoples. Yes, Priti Patil, very fast. Kiran, you are also very fast. Yes, correct answer is pyrazine. Correct answer is pyrazine. Correct answer is pyrazine. Very good. Very nice. Fantastic. Incredible. So pyrazinamide is a pyrazine containing drug. we have seen in the classification. Pyrazinamide is a first line agents. What, which ring containing? Pyrazine ring is containing or present in pyrazinamide. So pyrazinamide means what? It is a 6-member heterocyclic ring containing 2 nitrogen, one at 1 and second at 4th position. So nitrogen is at 1 and 4th positions in a 6-member ring. INE. See here, if you're not able to remember the structure of pyrazine, then I will show you how to remember it. Okay. So INE means what? 6-member unsaturated ring. INE means what? 6-member unsaturated. Aza means what? Nitrogen is there. And pyra means what? So pyra is also useful for nitrogen. So 2 nitrogen, one at 1 positions and second at 4th position. So simple to draw the structure of pyrazine. So INE suffix for 6-member heterocyclic ring, AZ prefix for nitrogen, pyra prefix for also nitrogen. तुम्ही म्हणाल सर आता पायरा कुठून आणलं तुम्ही नवीन गोष्ट? अरे पायरोल, पायरॅझोल, पिरिडीन, पिरिमिडिन या सगळ्या स्ट्रक्चर मध्ये PYR ने स्टार्ट झालेले. म्हणजे PYR हा कशाचा प्रिफिक्स आपण लक्षात ठेवण्यासाठी ठेवू शकतो? दॅट इज फॉर नायट्रोजन. सो फर्स्ट फॉर फर्स्ट पोझिशन, दिस इज फॉर थर्ड फोर्थ पोझिशन and INE stands for 6-member heterocyclic ring. So this is way, by this way you can able to remember the structure of pyrazine. Yes, nitrogen. So pyrazinamide, if you see this word pyrazine, okay, and amide. So pyrazine plus amide. Amide functional group means what? C double bond O NH2 is a amide functional group. आपण फंक्शनल ग्रुप शिकलेलो होतो, हो की नाही? म्हणून मी फंक्शनल ग्रुप तुम्हाला आधी शिकवले, कारण स्ट्रक्चर काढायला मग आपल्याला चांगल्या पद्धतीने लक्षात राहतं. सो पायराझिन प्लस अमाइड. सो अमाइड मीन्स व्हाट? C double bond O NH2. So if you know the structure of pyrazine, okay, and if you know the structure of functional group amide, then it is very easy to remember the structure of pyrazinamide. How? So just draw this pyrazine and add the amide functional group at 2-number position. So like here, C double bond O NH2. You can numbering from this nitrogen atom and go clockwise, because if you number like this, substituent carrying carbon will get 6 number. If you number by using these directions, then this direction, then what? You will get substituent carrying number at 2. So this is the correct. Okay. So 1, 2, 3, 4, 5 and 6. This is the numbering position for pyrazinamide, and IUPAC name is pyrazine 2-carboxamide. 2-carboxamide. Okay. Don't directly use the amide, because it is pyrazine 2-carboxamide. Pyrazine 2-carboxamide is the correct name of this pyrazinamide. So if you observe the both structures in front of each other, then you will come to know that this is the basic heterocyclic ring and this is the structure of drug. So what is difference? Difference is what? Just amide functional group at 2-number position. So either you can add here, you can add here, you can add here, or you can add here. So another trick is that you can add anywhere the amide functional group in the ring. Just don't add on this nitrogen. लक्षात घ्या, असं काही नाहीये, तुम्ही कुठेही ऍड करू शकता. तुम्ही म्हणता सर इकडे सरांनी इकडे ऍड केलं म्हणून चालेल, असं काही नाही. तुम्हाला वाटलं तुम्ही इथे ऍड करा. ओके, तुम्ही या ठिकाणी ऍड केलं की मग काय होईल? हा तुमचा amide functional group आला. If you add here, okay, then numbering get changed as per our numbering rules of numbering. 1, 2, 3, 4, 5, 6. So here one more trick is that pyrazine ring, add amide group at any positions except एक्सेप्ट 1 and 4 पोझिशन. 1 आणि 4 पोझिशन म्हणजे नायट्रोजनवर ऍड करायचा नाही अमाइड फंक्शन. तुम्ही कुठेही ऍड करा, कुठेही. लक्षात घ्या, तुम्हाला आता 2 पोझिशन दाखवले, तुम्ही या ठिकाणी पण ऍड करू शकता. Okay, once you have added the amide functional group anywhere, then give the numbering. Now numbering start from here, 1 2. So similar, pyrazine 2 carboxamide. If you add here also, you can use the numbering like that, 1 2 3 4 5. So pyrazine 2 carboxamide is the correct name of this structure. Okay, so this is how simple you can able to remember the structure of pyrazinamide. So name itself, pyrazine plus amide. So pyrazine ring plus amide group at any positions, and then you give the numbering in a such a way that your name should be pyrazine 2 carboxamide. Okay, very good. Now we will shift the second line agents. So dear students, we will require only 5 or 7 minutes. So we will finish these things and then we will stop here. So second line agents, example is para-amino salicylic acid. Para-amino salicylic acid. So para position means position number is what for para? Yes, reply fast. Para means what? Which position? Mention the position number for para. Yes, be fast. Kiran Badguzar, para position. Yes. Shubhangi Gomti, you are given the correct answer. Ganesh Allat, you are also right. Samir, you are right. Mangesh is right. Near meta position. Okay, okay. So para means what? The fourth position. So it is also called as 4-amino salicylic acid. Why I am asking the questions to you? Because 2 and 4 is ortho. Not 2 is ortho, 4 is para. So why I am asking? Because this PAS or para-amino salicylic is also called as 4-amino salicylic acid. 4-amino salicylic acid. Brand name for this PAS is Pacer. Brand name for this PAS is what? Pacer, which is used in the treatment of tuberculosis, no doubt. Sometimes it is useful in a combination of isoniazid or streptomycin. So it is also used in a combination with isoniazid. As it is second line agent, means what? It has a more toxic effect than that of first line agent, which is available in white crystalline powder, which is hygroscopic in nature. When we have studied the antiseptic and disinfectant, that time also we are come to know that the hygroscopic in nature. What is meant by hygroscopic in nature? It is nothing but that particular compound has ability to absorb the moisture from atmosphere. Okay, and because of that, it will get darken on exposure of light or an air. It is soluble in water. So if light is bombarded on the para-amino salicylic acid, so it will get dark. So property get changed, stability get changed. So to avoid that two conditions, it should be stored in an airtight and light resistance container. ह्या दोन प्रॉपर्टी मुळे पॅरा अमायनो सॅलिसिलिक ऍसिड कशात स्टोर करतात? इट शुड बी स्टोर्ड इन अ एअर टाइट अँड लाईट रेजिस्टन्स कंटेनर. एअर टाइट असेल तर हायग्रोस्कोपिक नेचर आपण काय करू शकतो? अवॉइड करू शकतो त्याचं, म्हणजे त्याच्यामध्ये मॉइश्चर राहणार नाही. आणि लाईटच्या एक्सपोजरवर जर तो डार्क होत असेल तर लाईट रेजिस्टन्स. ओके, सो इट शुड बी इट शुड बी स्टोर्ड इन अ एअर टाइट and light resistance container, or you can say amber color bottle. Okay, amber color bottle is what? Which is a light resistance container. So sometimes the calcium salt is used, mostly the sodium salt is used, but the calcium amino salicylate that is salt of pass is used for the patients which are restricted on sodium diet. जे सोडियम डाएटवर रिस्ट्रिक्शनला आहेत त्याच्याकरता मग कॅल्शियम अमायनो सॅलिसिलेट्स हा ड्रग वापरला जातो. हे लक्षात राहिलं ठीक, नाहीतर जाऊ द्या. म्हणजे कुठला सॉल्ट वापरतात तर कॅल्शियम सॉल्ट वापरतात, कारण डायरेक्ट ऍसिड आपण घेऊ शकत नाही. लक्षात घ्या, डायरेक्ट ऍसिड आपण कुठलाही घेऊ शकत नाही. जर डायरेक्ट ऍसिड घेतला तर आपल्या जीआयटी मध्ये ऑलरेडी ऍसिड असतं. तुम्ही जर ऍसिड घेतलं तर अजून ऍसिडिटी वाढते आणि मग कॉम्प्लिकेशन्स वाढतात. म्हणून डायरेक्ट ऍसिड कधी घेत नाही, तर त्याचा आपण सॉल्ट फॉर्मेशन मध्ये घेतो, आयदर सोडियम सॉल्ट और कॅल्शियम सॉल्ट. ज्याला बीपीचा प्रॉब्लेम असेल त्यांना मग कॅल्शियम सॉल्ट दिला जातो. So this is the structure of para-aminosalicylic acid. Para-aminosalicylic acid. This is the structure. Numbering is like that. So just reply the IUPAC name of this compound. IUPAC, I am asking for IUPAC name, not common name. Yes, be fast. So after that, we have only one slide to discuss, and then we will finish up the today's lecture. Yes, come on, try to give the IUPAC name. So it is not 4-aminocyclohexane. Very nice, Penbit. You have given the correct answer. Very good. Very good, very good. Penbit. 4-amino 2-hydroxybenzoic acid is the correct answer. Tushali, how 2-oxo will come? It is OH, not C double bond O. Okay. It is OH, not C double bond O. So correct name is what? 4-amino. So amino group is here at 4 position. At 2 position, hydroxy group is here, hydroxy and benzoic acid. So this is the benzoic acid. हे लक्षात ठेवलं पाहिजे आपण. बेन्झीन प्लस कार्बोक्सिलिक ऍसिड इज benzoic acid. So 4-amino 2-hydroxybenzoic acid is the IUPAC name of PAS. So you know benzenes look like that. If you add a carboxylic acid group on benzene ring, then it will looks like that. You can add at any position. You can add at any position. That is C double bond O OH. This is the carboxylic acid. That time it is called as benzoic acid. So if you know the structure of benzene, convert it into what? Benzoic acid. How? Benzene plus carboxylic acid. Benzene plus carboxylic acid. So it is written as C double bond O OH. Or you can write like that also, C double bond O OH. जे बेन्झीन रिंगवर जर आपण कार्बोक्सिलिक ऍसिड टाकलं तर बेन्झोइक ऍसिड स्ट्रक्चर होतं. ह्या बेन्झोइक ऍसिडच्या स्ट्रक्चर मध्ये ऑर्थो पोझिशनला म्हणजे 2 नंबरच्या पोझिशनला जर तुम्ही हायड्रॉक्सिल ग्रुप जर ऍड केला तर सॅलिसिलिक ऍसिडचं स्ट्रक्चर होतं, विच इज युजफुल ॲज अ अँटीफंगल एजंट. म्हणजे काय केलंय? We are added, sorry, we are added hydroxyl group at 2 position. Hydroxyl group at 2 position. That time it is called as salicylic acid. And our structure is name of drug is what? PAS. Okay. PAS means what? Para amino salicylic acid. So this is salicylic acid. So how to number? Carboxylic acid is the most prior functional group. If you know or if you remember the priority table, okay. So priority table having the priority to carboxylic group. So number started from one number, and you can give the numbering in such a direction that substituent carrying carbon atom must possessing the lowest possible number. So 1, 2, 3, 4, 5, and 6. Para means what? Fourth position. Para means what? Fourth position. So you have to add amino group at fourth position. You have to add amino group at fourth position. Then your structure of PAS will get constructed. Okay, how? I will repeat it again. If you know the structure of benzene, convert it into benzoic acid by adding the carboxylic groups. Benzene to benzoic acid by adding the carboxylic groups. Then benzoic acid to salicylic acid by adding hydroxyl group at 2 number position. And then salicylic acid to PAS by adding the amino group at 4th position. So this is how you can able to remember, or you can able to draw the structure of para amino salicylic acid. And its IUPAC name is 4-amino 2-hydroxy benzoic acid. Okay, so this is how you can able to remember the chemical structure of drug. So dear students, thank you very much for your attentions for 1 hour and 10 minutes. Okay.